sitting from here. For those of you who don't know me, I'm an occupational and public health physician in Quebec at the Quebec Institute of Public Health and in the Department of Social Preventive Medicine at the University of Montreal. And I work, occupational health is part of public health in Quebec. I work in the occupational health unit within the public health, the Quebec Institute. But I've been involved in CPD for decades now. And I'm just going to talk a little bit about the Section 3 credits at the Royal College. The first part is about the basic facts around it and some of the sources and the types of things that have been developed for Section 3. The other part is I want to encourage a discussion among us about innovations that we can do around it. So, and to have some discussions at each of your tables and then present it to the group as a whole. So first, I have a conflict of interest. The learning objectives, which are to describe the types of CPD activities recognized for Section 3 credits by the Royal College, identify CPD activities that evaluate one's practice in public health, and establish a plan to help each of you to establish a plan to complete a Section 3 CPD activity. But just a quick overview of the maintenance of certification program of the college. It has 3 learning sections. Section 1, which is the group learning, which are basically conferences and journal clubs and small group learning. Section 2, which is self-learning, particularly things like personal learning projects. These are activities that are planned to address specific needs or focus, and they're to enhance awareness of new evidence potentially relevant to our practices and enhance the quality of multiple systems. And assessments, which is Section 3. And those are activities that provide data and feedback to individual physicians or health teams that facilitate the identification of CPD needs in areas of knowledge, skills, competencies, and performance. And just to have an idea of, philosophically, in terms of the number of credits per hour engaged in some of these activities, you get 1 credit per hour for an accredited conference, 2 credits per hour for a personal learning project, and 3 credits per hour for an assessment activity, with the idea that a focused learning project gives you better CPD value than just attending a conference, and that doing an assessment where you independently of your own self-assessment identify CPD needs, and you understand what your weaknesses or needs are, is a much more valued activity, and that should promote would improve the quality of practice in each of the specialties. So that's sort of the logic of some of the credit hours that come and the value placed on these different kinds of CPD activities. It has to do with pedagogic theory as well. So the maintenance certification program requires each specialist to have 400 credits per 5-year cycle, at least 25 credits in each of the 3 learning sections over the 5 years. So that means you need a minimum of 25 Section 3 credits. But because these are 3 credits per hour, that really only means you do over 5 years, 8 and 30 hours, which is a pretty minimal requirement when you realize it's not a huge requirement. Of course, we can go beyond that, but that's what the current requirement is. And we have to report at least 40 credits in each year of the cycle. Accredited credits, certain things need to be, like conferences that need to be accredited, have to be accredited by a CPD accreditation provider recognized by the Royal College. On their website, they have a list of accredited. Basically, most faculties of medicine have accrediting bodies, as do some of the specialty associations. You can choose as a specialty association to accredit things, but it means you have to have the resources to evaluate them and do all of that. Activities sponsored by industry, even if they're non-accredited activities, are not counted. Okay, so just very briefly, group learning, the Section 1 credits, those are divided into accredited, group learning, and non-accredited. The accredited ones, you in advance get credit. It means you look for learning objectives that's based on a needs assessment, you record everyone who's there, and you evaluate. And those are, and they're journal clubs or conferences like today, we're going to credit again for these 2 days. And that's 1 credit per hour, and that doesn't include breaks or lunch or things like that, it's the actual. Not accredited group learning activities or anything else, and they're only half a credit per hour. And you can have a maximum over the 5-year cycle of 50 non-accredited group learning activities. Section 2, self-learning credits. There's planned learning, there's scanning, and there's system learning. So the planned learning, for most of us, that's our personal learning projects, and you get 2 credits per hour, as I mentioned. If you do a fellowship or a formal course or traineeship, there's different credits for that. Scanning is when you just more randomly read. You can, it could be in a focused way, but if you're reading, not in the context of a personal learning project, but just reading. It could be a book chapter, an article, and there are different credits associated with that. Poems are worth a quarter of a credit each, and podcast audio is half a credit, but you can see. System learning. So those are learning stimulated by participation in activities such as setting practice standards, patient safety, or continuous quality improvement, curriculum development, assessment tools and strategy development, being on specialty examination boards or peer review of either research grants or scientific articles. And so for clinical practice guidelines, you can get 20 credits per year. For participating in performance review within institutions, 15 credits per year. Curriculum development, 15 credits per year. Maximum examination development, 15 credits per year. And peer review, 15 credits per year. But section 3, this is what we're really talking about. This is either knowledge assessment or performance assessment. So for knowledge assessment, these are self-assessment programs, but that have been approved by the Royal College, by an accredited CPD provider. They provide data and feedback to the individual's position regarding their current knowledge, and they enable the identification of needs and development of future learning opportunities relevant to our practice. And there are a whole host, which I will mention later, of already existing self-assessment programs, and we can develop them. In Quebec, we've developed 1 or 2 of them already. In performance assessment, so these are activities that provide data with feedback to individual physicians, groups, or interprofessional health teams related to their personal or collective performance across a broad range of professional practice domains. Performance assessment activities can occur in simulated or actual practice environment. So there's a whole host of accredited simulation activities. They are especially in the case of surgery or in CPR, things like that. There are other, but they can also be simulations in environmental health and in other areas. Chart audits and feedback. So this is things like going through the reports that you write or outbreak,
outbreaks.
Yeah, infectious disease outbreak and the reports that you write, you can review those. Multi-source feedback, I'll be talking about what that means. It can be where somebody outside is doing direct observation of your performance, or getting feedback on teaching, annual performance reviews that may happen in your workplace, and practice assessment, which I'll talk about what those are. So most of the assessments are thought of in relation to the specific candidate's competencies. So medical expert, professional, communicator, collaborator, leader, health advocate, scholar. And I'm going to now talk about some of the examples that have been developed. The Medical College of Canada developed the MCC 360. I'll give you more details about it in another slide. But it's an assessment of performance of individual physicians in 3 of those competencies. Communicator, collaborator, and professional. And through assessment questionnaires that are sent out to colleagues, physician colleagues, non-physician coworkers, and patients. In Quebec, we have an analogous program that's been developed that's called the PRPP, that I will talk about, that was developed by the Federation of Medical Specialists in Quebec. Any workplace performance assessment, many of you work for organizations that will do annual performance review, and your deliberations, thoughts about that, and making plans to address any any weaknesses or needs, knowledge needs or performance needs, you can claim as Section 3 credits. In Alberta, Manitoba, and Nova Scotia, there have been programs called Physician Achievement Review, PAR programs. They were developed in Alberta with the University of Calgary, and I'm not sure if they were adapted to public health at all. They certainly do it for clinicians, but in Alberta, that's been replaced. Since about 2017, they've replaced it with the individual practice review, which is multi-source feedback, but very clinically oriented. What's on the website about that is would have to be adapted in a major way to apply to public health. And for those of you who are from Alberta, you may know better than I do whether they've actually done anything to do individual practice review for public health. Publishing in peer-reviewed literature, or applying for peer-reviewed grants. The time you spend revising publications based on peer review or revising a grant proposal based on peer review, those are Section 3 credits for those of you who do research and write. Teaching, if you get evaluations from your students and you think about what you review those evaluations and you think about how you might change your teaching strategies based on that, those are Section 3 credits. And doing chart audits, another based assessment. So thinking about, okay, what are the pieces of the kind of work I do? Do I do scientific advisories? In Quebec, we call them avis scientifiques. We certainly do that at the Quebec Institute of Public Health. Guidelines, reports, literature reviews, outbreak investigations, other investigations of environmental hazard, or even ad hoc, your reports on ad hoc times when you get called as a public health physician to address things, whether it's a spill, an environmental thing, any other health promotion thing, a natural disaster. If public health is called in, you can develop specific criteria on how to evaluate reports and do a chart review. But it's important that you're not the one only reviewing your own report. You can participate in it, and you can review several of them, but there have to be other people who are reviewing it. You have specific criteria and the reports, and then you get feedback. And the idea, in Quebec, we have different ways of doing that I'll talk about soon. And the idea is really to improve the practice of the organization. Not just, of course, in the context of Section 3, it's to improve our own personal performance, but also it's to make sure as an organization we do a better job of dealing with some of these ad hoc things, or that we make sure we're as systematic as we can be. So a little bit more about the MCC 360. The 360, I think, is for the idea that it's a 360-degree perspective. So it's bilingual, it exists in both languages, it's Canadian, it's multi-source feedback. Based on the candidate's physician competencies. As I mentioned, it's a set of surveys taken by a statistically significant cohort of one's physician. You decide who it gets sent, well, in Quebec you decide who it gets sent out to. And it's your physician colleagues, non-physician coworkers, and patients. In our case, I imagine it would be our partners and collaborators, our clients. And the physician does a self-assessment. And often this allows a comparison of what the physician evaluates themselves to what the people they're working with or their clients are evaluating. And there's lots of data that as physicians, we're not that good at self-evaluation. People tend to perceive themselves around the median, and the people who really score much higher tend to underestimate, and the people who score in the lower quadrants tend to overestimate their performance. So having independent evaluations can make a really big difference in getting useful feedback. So in the case of the MCC 360, the responses are collated, analyzed to yield a report with quantitative feedback, and narrative free text feedback from the raters. It's always paired, in their case, with a scheduled time with a peer physician feedback facilitator to help interpret the feedback, highlight areas for development, and build a personal action plan. This report is intended for self-improvement purposes and offers insight into existing strengths and tangible information you can use to improve your practice. As a physician, you can go on the website and actually ask to participate in it. In certain provinces, the College of Physicians demand, where there have been complaints where there's problems with the physician's performance, they can demand that the physician participate in this project. And there's a website for that. In Quebec, the practice-related personalized feedback program, the PHPC, the Programme de Réflexion Personnalisée sur la Pratique, has recently been developed by the Federation of Medical Specialists, and it's a program that allows the specialist physician to do the same thing. Here, it's really, it looks at, most other than medical expert, it looks at all the candidates' competencies: communicator, collaborator, leader, health advocate, scholar, or professional. There are 3 types of questionnaires. Again, it's been really designed for clinicians. So it's physician, non-physician colleagues, for patients, and for people using your clinic. And so we just spent our last CPD conference of our specialty association thinking about how to adapt these for our own specialty. But I think more work needs to be done on that. And because the idea is you identify who gets sent out to. As soon as there are at least 5 people who responded, the FMSQ, they collate the information and provide you with a feedback report, and they compare both your results on the same dimensions to your peers, so other people in your specialty, as well as compare your self-assessment to what you got from your raters. There's a whole host of existing self-learning programs. The Royal College website has existing self-learning programs, and some of them go across all specialties. They can be on ethics, they can be on CMPA ones, on medical legal things, they can be on all sorts, on leadership, on things that go across specialties, and are self-learning projects that already exist. There's accredited simulation activities for those of you who are involved in things that would be relevant for. And as I mentioned, the CMPA, they have a lot of online courses, and several of them have medical legal self-assessment programs that can count as Section 3 credits. And in Quebec, we don't have a single, like we have the OMA or the Alberta Medical Association. We don't have one medical association, we have 2. We have a Federation for Medical Specialists and a Federation for GPs. And the Federation of Medical Specialists not only negotiates with the Ministry of Health the amounts we get reimbursed, but it also is very involved in CPD. That we pay a lot of money to the FMSQ that comes out of our billings directly. It's thousands of dollars, and there is a really strong CPD office that oversees the individual specialty CPD committees. Each CPD committee, each specialty has to have a CPD committee. These are very rigorously accredited with strong evaluations. There are lots of things as a CPD committee we have to meet, but we also get money to do CPD. So unlike our national association, we have we get reimbursed for the time we spend on our CPD committee. When we develop new projects, we get reimbursed for that time. It's not necessarily all our hours, but it isn't just volunteer work, so there's a recognition. This is important, and it comes out of our specialty association CPD money. And so it means that we can take this very seriously and develop tools. Anyhow, for the FMSQ, the PRPP, anyone can use it. It's in both English and French. And I don't know, in the arrangement we've developed between the National Association and Quebec, whether there can be a way that we can have the Canadian Association use the PRPP, or whether there can be a small cost for them to analyze people's data if they wanted to use this. There's also a huge catalog of online courses that includes Section 3 courses that exist in Quebec. Most of them are in French, but there are some that are both in English and French. And there's definitely Section 1 and 2 courses. And there are a number that are relevant to public health. And we, in our own association, have identified all the courses that are relevant to our association, to our specialty. And in Quebec, occupational medicine, although it's a separate specialty, is part of public health. We have one specialty association for the two specialties. And because occupational health is also a big part of public health, kind of dissolved together. And so it also means there's a lot more room with the Federation. There's interspecialty, there's a conference every year, JFI, which is an interspecialty collaboration on professional development, where we often, as a specialty, either in occupational medicine or in public health, collaborate with other specialists, rheumatologists, surgeons, whatever, on specific topics that are relevant. So it's another way of kind of making our specialty known to the clinicians. So, right, in Quebec right now, our own College of Physicians has, as of 2019, has established new CPD requirements. So all doctors in Quebec, both specialists and GPs, full-time or part-time, have to submit 250 hours of CPD. These are hours, not credits. But so a little less than what the Royal College demands for a 5-year cycle. At least 125 hours have to be accredited or recognized CPD hours, and at least 10 hours are practice evaluation. So a little bit more than the Royal College, because it's 8.3 for the Royal College, it's 10 hours over 5 years for Quebec. At most, 115 hours are non-accredited and non-recognized hours, which means that the learning projects currently aren't really recognized as recognized CPD in Quebec. But they've said they'll recognize anything that the Royal College recognizes for those people who are part of the main board. So, and you have to have a minimum of 25 hours of CPD, registered CPD, and as opposed to the 40 we need for the Royal College. The recognized activities include teaching, so for every hour that you teach, they'll recognize 3 hours of preparation. If you write a journal article or do peer review of existing articles, those hours get credit to a maximum of 60 hours over the 5 years. If you mentor others in a structured way, there's a maximum of 60 hours for, over the 5 years. And CPD credits can be transferred, as I said, from the Royal College directly on. They have a way of doing it, so we don't have to do anything. We are a main point of stress. So as I mentioned, so we have the FMSQ CPD office and our specialty CPD committees, which means that we have time, and we've been thinking about Section 3. The last 3, our CPD conferences over the last 3 years, because we knew these Quebec new requirements were in the works. So we've been trying to understand, what does practice assessment mean? And we participated with the FMSQ on developing some of this stuff. But it's still hard to get it really developed for our specialty, and we still have lots of work to do to adapt it for our specialty. But another thing we have is, in Quebec, all public health physicians, like all other physicians, are attached to a hospital and have a clinical service. So if I'm at the Quebec Institute of Public Health, I'm also a member of the Preventive Medicine Public Health Department of the University of Montreal Hospital. And as such, I have a clinical service. And in our clinical services, one of the things we're supposed to do is the evaluation of medical acts, as all physicians are supposed to do. That what we always have a committee, we have a CPD committee, we have an evaluation of medical acts. And in public health, this exists like all across the province. So no matter which region you're in, you will belong to a hospital that has a CMDB, is a committee for doctors and dentists that regulates us, because we are self-employed. None of us are salaried. We are self-employed, and we bill the RAPQ for our public health acts and procedures. And we're regulated through our CMDPs, kind of a slightly complicated system. But the point is, in the context of l'évaluation des actes médicaux, we've had to think about what's a public health act and how we might evaluate it. So at our last conference a week or two ago, we really looked at some of the innovative ways people have done that and how those might be relevant to Section 3 credits. And I'm going to talk about some of them. So, for example, at the ENSPQ, the Quebec Institute of Public Health, we've developed very systematic ways of evaluating any scientific advisories that are written up, or reports, or reviews, or studies, or public health practice guidelines. And I'll describe some of the categories that are used, so that we'll take them and we have a committee that will evaluate them. And having something you've written do that with Section 3 credits, and getting that feedback and revising it with all these Section 3 credits. In other groups, they developed worksheets to evaluate even ad hoc reports, and to look at, do they meet proper reporting requirements, and do they include each of the kinds of things that you would want to have in that kind of report, to make sure that we're doing quality reporting, even of ad hoc events. And with the idea that each organization improves that. And in one that was developed in Sherbrooke, they developed 39 criteria that cover diagnosis, the nature of the intervention, the follow-up, and general conduct, like the reporting. They have developed forms in different regions for specific kinds of things, like outbreak investigations, or how to audit public health charts. And we need to think about being creative about what are the activities we do that we think would be worthwhile evaluating, that we would actually get something out of it in terms of improving our performance. It won't be impacted on us. And in our case in Quebec, these are always confidential. They don't go out to the rest of they go to the person, and the overall data will go to the CMPD for the institution, but not the individual physicians. So it's a lot like mortality, morbidity rounds, things like that. Those are all types of Section 3 things. Yes, like the worksheet I was talking about that we developed at the Quebec Institute. So there are a total of, I think it's 15 criteria. And so one is for the presentation of the context and need for the document, the conceptual framework and methodological approach, there are 4 criteria, how it addresses ethical issues, 3 criteria, and then its impact, conclusions, and recommendations, there are 7 criteria. So this is one way of doing it, and this would be something that would be easy to implement, certainly in organizations like the Public Health Agency of Canada, or the Ontario Public Health Agency, or CDCBC. But some of this would be relevant to individual health units as well that develop scientific advisories. The challenge for all of us is to make seeking Section 3 credits meaningful. It's not hard to find an existing, do a CMPA one, but the point is to actually use it in a way that has meaning for us, so that we evaluate our practice in a way that allows us to truly identify how we could improve our practice with respect to one of the candidates' competencies, and to create tools that meaningfully allow us to evaluate public health practice to improve the overall quality of what we do. Because it's easy when, especially if you're in areas where there aren't many, where there's only one MOH. In Quebec, we happen to have a lot of physicians involved in public health, more so than the rest. I think practically half of public health specialists in the country are in Quebec, because we use the role of doctors is much more content-oriented than in other areas. But anyhow, but I think that that's the big challenge to all of us, to try and make this a useful way of identifying our own needs. So I'm going to stop here for a minute to take questions, comments, and then I've got a few things to open up the discussion in the room. So any questions or comments presented so far? Yes, Joel.
So thanks very much for a really clear and helpful presentation. What do you think, partly in the context of the previous conversation, that Public Health Physicians of Canada could do to support our members and other public health practitioners, other public health physicians to obtain these credits, especially in the more difficult Section 3 areas.
Okay, yes, I think what we really need to do is to develop Section 3 tools. Okay, and for example, adapting either what the Quebec one is, or the MCC one, because I'll bet anything, if we actually look at what their questionnaires are, they're very clinician-based, and I don't know that they're really adapted to public health. So we would need to work with them to do that. And also just, I didn't look at whether there was any cost for the MCC, if you as an individual physician want to do it. Also, we can develop self-assessment tools. For knowledge, that's very easy. To get some grants, do an online course like the one on the health system. That could be one that good for, not just for residents, but for practitioners, and making sure that that people want to upgrade their knowledge when things have changed and how things are organized. But not on any new topic, we can develop a knowledge-based self-assessment and get a grant from somewhere to do that. But I also think if we want to look at competencies like communication, collaboration, or if we want to think about, well, what would be the best way to evaluate outbreak investigations? We can, like what they did that they pulled together what existed and did it. We can establish a sort of a plan over the course of 5 years where we develop 3 tools. But we need the resources, the financial resources to do that, because it takes time. And you either hire people to do it, or you can hire residents, or you get a grant from the Royal College and from our own CPD, or their money from other sources, the Public Health Agency of Canada. But I think it's really important to think about, okay, what are the competencies that there might be would be the most useful, and we choose 3 kinds of tools we're going to develop over the course of the next 5 years, and we put those online in the same way that we do it in Quebec, that we do it nationally. I think that's feasible. And one of the things I'm hoping with the questions I'm going to ask you, that you think about what kind of tools would be most useful where you are and that are really needed. What are the competencies we should be looking at? And I've talked about some of the strategies that have been developed, which are basically variations on the MCC 360, but there may be, or where, like, we have committees that do it, so people, and what we could do is where people are, you could have people in 3 different provinces getting together online in a community of practice.
Community of practice.
Yeah, community of practice, where you evaluate each other's outbreak investigations, or environmental outbreak, or whatever it is we've decided we want to evaluate. So we could do it across the country where there isn't enough people to do it in your own organization. So, yeah.
Sorry, Susan, I was really interested that you mentioned that knowledge assessment is also part of Section 3, not just performance assessment.
Right.
Performance assessment has been really the big focus in Quebec recently. But just getting back to the question, the previous question was what could the PHPC do? Maybe something like an online knowledge assessment course on different topics, sort of like what the American Board of Preventive Medicine offers. They have different courses online that you could choose to take and retake and retake, not just in preparation for a board exam. But there's nothing that obliges you to do the board exam in the States. You could just keep on taking those prep courses every year, and it should count as credit 3 because you're getting feedback on your own knowledge on toxicology or epidemiology. There's some that are on public policy, which has nothing to do with Canada. But maybe PHPC could look into those types of online courses that the American Board of Preventive Medicine already offers and adapt them to a Canadian context.
Are they expensive if you actually do some of the content areas might be relevant?
Yeah, some of the content areas like in toxicology or epi and stats I mean, that doesn't matter which side of the board you live on. So that would be really good as review courses, testing your knowledge, getting your feedback. And I'm wondering if those types of courses would count as credit 3, and maybe PHPC could look into developing its own suite of complementary board exam prep courses, a bit more on Canadian content, Canadian policy, Canadian health structures.
I'd be remiss if I didn't point out Queen's Public Health and Medicine National Review course, which many of you contribute to, October 21st and 25th, 5 full days, 35 accredited hours, plus exercises in public health emergencies in the evenings, completely accredited, supported by PHPC. Wonderful opportunity. Many practicing physicians have attended and have given us great reviews as a fundamental review of all of our core curriculum and competencies. 5 full days. Lovely to have a visit in October in Kingston. You're all very much welcome.
Sorry, can I just ask you, right now, I would have assumed this is section 1 credits, or do you get feedback on the exercises?
Yes, we get credit, multiple different types of credits for it.
So you have section 3 credits for it?
Yes, absolutely built into the exercise events in the evening.
So you take the responses, they can do them, and you evaluate.
Yeah.
Great.
Over 35 hours, and it's cheap. It's way cheaper than going to the States.
So it would be great to let that be, for that to be advertised to all members.
It is.
Yeah.
Oh,
I would.
okay, there's another question here.
I'm just thinking, in terms of something.
Sorry, because I don't know a lot of you, because I'm in Quebec and don't all.
Oh,
Here, just
Kirk,
give your answer names.
I'm
Okay?
Kirk, yeah.
Right.
I'm a member of the council.
Right.
So I'm thinking that we also want to do things that don't actually take the public health physicians who are in a busy practice a lot of extra time and maybe provide value added as PHPC. So what I'm wondering is, with section 3, some of it is communicator, right? So a lot of people here in the course of their daily work actually talk to the press, and you can take that. So could PHPC actually develop a group that just reviews your interview on pandemic, on measles, on whatever it is, and give you a certain number of credits? So all you have to do basically is tape it, send it in, and then we give you a number of credits. That's no extra work for you.
But it's a huge amount of work for the group to do the evaluation.
It would be, but still, I think that it would cost you nothing. It would basically save you a lot of time running around doing extra work and, listening to a CMPA talk on medical leave, which I'm sure most people want to throw up rather than do that. So anyway, I just think that if there was a possibility for PHPC to have a small group that would listen to that, give you a certain number of credits, there must be a way to do that kind of thing.
There is, but it means that you have to have a group of, a committee that would develop the criteria by which to evaluate those, which is not too hard to do. We have lots of standards on that, and would have the time to go through them, evaluate it, and provide presumably written feedback to the person on the strengths and weaknesses of what they presented based on those criteria. So, and that's a lot of work for that committee.
But they would also get credit hours for doing that?
Absolutely, that would be section 2 credits that the people working on it would have, and maybe it might be something that the emeritus committee would want to take on.
Ooh, she true. Now, I found out a feedback. I just got feedback. That's level 3 credit, right on that moment.
This is over 5 years, and it's 8 to 10 hours. So even if people are very busy, that actually isn't a lot of time to ask. And doing something fairly simple, I think that's a great idea, but not to forget that the additional component is not just have someone else write down the feedback and then you can check off your box, but to actually start using that feedback and then take the next step of the demonstrated change to your practice as a result, which is the critical spirit of having these Section 3 credits.
I think that's a really important point, that the Section 3 credits are not for having it evaluated. It's for reviewing those evaluations and changing or making a plan to act on that. That's what the Section 3 credits are for. sorry, did I cut you off? Did you?
No, that's what I wanted to say, exactly.
Yeah, no, I think that's really important. Just in relation, go on, yeah, go on to the next.
Andrew Gray at Northern BC. So one thing I'm trying to understand here is evaluation is already kind of part of a lot of our practices in the sense that, say we develop an immunization strategy and then evaluation is part of it and we see how that impacts immunization rates and then we change the strategy. And I'm part of that, part of developing and rolling out that strategy. So my practice is
it has to be an evaluation of you personally.
yeah.
Okay,
but
or
like the reports that are come out by S&P, for example, aren't necessarily written by one person.
right,
Are they?
yes, but so it would
you
be the
expect-
authors of that getting feedback. So yes, and it would be certain, you'd have to demonstrate that it's evaluating, it could be evaluating the effectiveness or the implementation. And, but to make it section 3, it has to make sure that that a piece that you have actually contributed to it is being evaluated independently of, that it's not the committee itself who developed it that's doing the evaluation. It has to be somebody else who's doing the evaluation. Or that you're using independent data. So if you're using objective data independent of, it's not the perception of the people who developed the strategy, but that you're using objective data that is coming in to evaluate it, and that you spend time thinking about and analyzing that data so that it changes your practice. That could be a health team evaluation, and so that would be absolutely part of it. The other thing, just to go back to the communication stuff, one way to do it that is less resource intensive is that you give the audience that you've just done that talk to an evaluation form based on the forms that have been developed for measuring communicator and collaborator, and that they actually rate your performance. And having somebody collect that, collate it, and allowing them to have not just to give comments as well as rating it on scales. Just doing that and reviewing what that said is absolutely section 3 credits. But it needs to be on criteria that are relevant to your performance of that.
So can you give us a more concrete example? Like we have accredited journal club.
Yes.
They can be accredited, so we get 1 hour per hour for the ones that attend. But the one that prepares the journal club, they don't get any, they can get...
They can make it a personal learning project.
Yeah.
They get 2 hours.
But if we get evaluated, we can also count the credit 3. Like they evaluate the journal club, your communication abilities, and did you were the objectives.
If you have a formal process.
Yes, we do. But
For
then how
evaluation.
many hours could you count for that? Let's say we have a 1 hour journal club, it's evaluated formally.
Okay, but the
How many
formal
credits?
evaluation takes how long? 10 minutes, 15?
For maybe, 10, for the ones that complete it, just 10 or 15 minutes.
Okay, but no, to complete the evaluation, but the evaluation that the person gets,
Oh, okay.
the time they spend reviewing those evaluations and making a plan to change the next time they do it.
Okay.
That's the section 3 credit.
That's the thing. So that's what we would have to check, how much time it takes us to...
Well, and usually if it's a 1 hour thing, they might spend half an hour, 20 minutes,
Okay.
or maybe an hour. There were major things, and they can turn it into a learning project as well if it was suggested that they do something very different about how they're doing it, or they're
We are not
missing a
counting
piece.
this time as credit 3, but we could. Actually.
You could, if somebody's actually collating it and the person
Yes,
gets those
somebody,
evaluations, then yes,
Okay.
definitely.
Well, this follows directly from the last 2 comments, but as a full-time faculty member, I'd be remiss if I didn't encourage people to volunteer to do a guest lecture in a class, because they get evaluated, and you get that the formal process, they already have the forms, or even a grand rounds, that these are all evaluated. So think of your public health school that you're affiliated with, or that could be or should be, or in your area, and volunteer to do a guest lecture once every 5 years.
And make sure they send you the evaluation. Because that's what you need to have that evaluation, those evaluations. And then you can look at, what proportion of the people who attended actually evaluated, so that like the validity of the evaluation comes in. Usually if it's a course, if you're a guest lecturer in a course, the proportion that evaluate is usually much higher than those if it's a rounds.
Yeah.
Yeah. But thinking about meaningfulness. Any other questions or comments? So what I'd like to ask you now is, some of you mentioned things that you actually do right now that are practice assessments. Can you think of, what other things do you currently do in your own workplaces or in your provinces? Are there requirements? Do any other province have requirements I don't know about? Except for Alberta with its independent review. Yes.
I'm just going to say that it's easy for me because I do a lot of teaching. And so as Annalise said, that I try to ensure that the residents I teach provide me with evaluations, discuss the evaluations, and I always change what I do the next year on the basis of the evaluations. I actually hadn't thought I was doing Section 3 until today, but I think that qualifies, doesn't it?
It does indeed.
Yeah.
Hi everyone, my name's Jasmine. It's odd to walk into a room this way and looking this way.
Just turn the mic around.
So we talked about how this might fit into performance management and how part of those processes could be more robust for us, or looking more in detail at practices and how we'd be setting goals and objectives, identifying gaps and checking in on if we've met those. We talked about a number of other ideas, so I don't know if I'll do our group's discussion justice. I didn't realize we'd be reporting back, but that was a big part of the discussion.
Okay, Joel, from this table, just introduce yourself and say what your main assessment activities you have.
So I'm Michael Finkelstein from Toronto. We started to have a conversation about how work for the organization for the PHPC organization can fulfill Section 3 credits, where we're using our skills to for the profession, and whether feedback on how that's going through the membership could qualify, and how we would document that as a way of evaluating our contribution to making the specialty better.
Okay, in the table with Annette, who's going to speak? Just introduce yourself.
Any other Jasmine? I wasn't ready to report back, but I think our discussion parallel a little here in terms of looking at our existing group practices and the work that's there already and how it can be bolstered or formalized, and making sure that trail is there. So we're talking about practical things around group meetings and handover. We talked about the application of Eric's idea around media recordings and conserving that time as a group practice to do that as peers, and then looking at our involvement in the residency programs and having that. So it was more of a, aha, we do it a lot more than we do, let's just do it better.
For the residency program, you're talking about the evaluations the residents give of your teaching?
Yes.
Okay, we don't take away.
I don't think I need to use a microphone. So one of the silver boxes that Joel was talking about, the way I've done it over all the years, I'm on my second or third cycle of this, is first of all, I have a boss who always gives me feedback every year. So I spend an hour thinking about A, what he's going to talk to me about, and B, giving him a series of things to talk to me about, and then we have a talk about it, and that easily counts for an hour's worth of assessment on my performance as a manager and also as a leader in my organization. So that's one. The second one I use is teaching. So the University of Ottawa is very good about giving me a complete breakdown of what the students thought of my presentation or didn't think of my presentation, and spend an hour thinking about that and how it should change my performance the following year and what I should do in order to do that. 2 hours a year times 5-year cycle is easily gets you to the 25 that you need for a lead cycle. So that's how I do it.
Okay. And, okay, middle table?
So I'm Mustafa from Niagara Region of Ontario. We talked about a couple ideas. On the knowledge assessment side, we thought perhaps an opportunity would be there for practicing public health physicians to take the national residency practice exam that's done every year. And there's already, means of, getting creating that, getting feedback back from residents. That can be done to practicing physicians as well. That would be one way to do knowledge assessment. And the other thought we had was actually a very comprehensive audit of maybe a physician's practice. That you could set up something where, some physicians from another organization come over, get 360 feedback from everybody you work with, maybe look through some of the documents and work that you churned out, and then give some comprehensive feedback based on that.
Okay, the back the table just in behind that. Sort of middle back table.
So we,
Come to the mic
okay.
and introduce yourself.
Hi, my name is Jen. I'm a resident at the University of Ottawa. So we had a table with many residents and a practicing medical health who helped us answer some of these questions. But we had many questions actually around how we were going to address maintaining both our competence and CPD credits at the CFPC level and then transitioning into the FRCPC system. So if there's any feedback here, that would be wonderful to learn about that a little bit more. And then we talked about, certainly at the resident level, we have lots of different elements that would count towards all of the section 1, 2, and 3 credits. In particular, in Ottawa as well, we didn't discuss this, but we do a 360 review at the resident level of performance evaluation. And that's been, I can't say that's been adapted to our practice in public health, but it might be another tool to look at as part of looking at that 360 review and revamping maybe the MCC 360 review. And then, yeah, so I think we probably generated more questions than we did answers, but yeah, we had a fruitful conversation with that.
Thank you. Yeah, to both Michael and Emily.
I'm David McEwen, former medical officer of health in Toronto and elsewhere. The one idea at the table that some of us hadn't thought about before was being a co-author on a scholarly article or a co-applicant on a grant, which many of us do from time to time, involves getting peer-reviewed feedback, and the process of integrating that feedback, changing your work, would, we think, qualify as Section 2.
I'm from Fuller. I work for Biblioteca Geneta in Milwaukee. We actually talked about how this is actually really easy, and you're already doing almost all of it already. And things like doing TV interviews or radio interviews can easily be adapted, or lots of other ad hoc pieces of work that you do every single day. That even taking the time to do a quick lit review of, well, what is great communication, and how would I make 5 criteria for what is a great radio interview? So taking 1 hour to, or a couple hours to read through some literature or communicate with expert in human relations on what is the best way to have a radio interview, or what are key criteria. Did you emphasize your message 3 times? Did you clearly enunciate everything that you said? Was it understandable at a grade 8 level of education? Like a checklist of criteria. Taking the time to actually make that list is part of Section 3. Then having 1 or more other colleagues check it off with you, and you going through yourself and evaluating whether it's Section 3. And then taking an hour to discuss that back to the colleague who evaluated you, and, oh, well, why did you give me a lower mark here? What were the elements there? What do you think? How could I have said that better? What was the lingo that I used that was too complicated there? What acronyms did I throw around? And just getting that specific feedback. I mean, plus the actual radio interview, that's done, you're done for 5 years. Like, it's easy.
So, yeah. I just want to correct something. designing the form
Yeah.
is section 2 credits.
Oh, excuse me.
Doing the evaluation of other people's talks is section 2. Thinking about the feedback you've gotten, that's section 3.
Okay. I thought the process of putting together actually even like
No,
designing.
that's
the-
section 2.
Okay.
That's section 2 credits.
Even so, I think that the 10 hours is pretty achievable with.
Yeah,
those-
because we're reviewing it, because it's not a lot of hours, but just so that you understand the distinction between the development of evaluation tools, that's a section 2 credit. Getting feedback and changing your behavior and thinking about that feedback, that's the section 3 credit.
But getting feedback on the evaluation form that uses design is credit 3.
Yeah, absolutely, yes. Getting that feedback and acting on it, and reviewing
And
that.
making a better tool.
Yeah. No, but the section 2 credits are important too.
Yeah.
Okay, so what I want you to do right now is to just think about, identify and perhaps even write down what are 2 practice assessment CPD activities you will engage in 2019, 2020. Like what are practically, what can you actually do, will you do? And discuss it at your table and then choose one person to mention them. Or we can just actually have people pop up and share it. If it's something that hasn't been mentioned already, so the new things that you've come up with, if you choose some things that we've mentioned, that's great, that's fine. But write it down so you actually have a plan in your head of what you're going to do.
You want to hear them directly, or
What?
you say pop up and say
No,
one?
I want you to spend 5 minutes right now thinking about it, write it down, and then we'll go around and have people pop up to say new things that weren't already mentioned.